Good morning, everyone. Thank you so much for joining us on this press call on the HHS RIF with Senator Murray and others. This call will be recorded and distributed widely. And with that, I will go ahead and turn it over to Senator Murray.
Well, thank you all so much for joining me on this really important call. Yesterday, President Trump and RFK Jr. announced a major reorganization of the Department of Health and Human Services. Long story short, they may as well be renaming it the Department of Disease because their plan is putting lives in serious jeopardy. They want to push out 20,000 public health workers, cut essential programs willy-nilly, and undermine medical research, healthcare access, public health, and more, with no concern whatsoever for the fact that they are putting this country on a dangerous collision course. Trump and Secretary Kennedy are gutting our ability to track disease outbreaks like measles and bird flu in real time and respond to them. They are pushing out people at FDA, working to make sure our food and our medicines are safe, working to approve new drugs in a timely manner, and working to make sure that we respond quickly to save lives when food and infant formula are contaminated. They're making it harder for Americans to get help accessing health insurance through Medicare and Medicaid and the Affordable Care Act marketplaces. And let's not forget how Trump and Kennedy are putting promising biomedical research through the shredder. And they're empowering anti-vaxxers to light federal dollars on fire by investigating bogus, debunked conspiracies. Preventing pandemics costs something. Failing to prevent them, well, that costs a whole lot more. All of this is making us less prepared for the next public health emergency, whether it's a pandemic or a natural disaster, superbug, a foodborne outbreak, goodness knows what the next crisis will be. But instead of preparing for it, they are preparing to ignore it. And that's to say nothing of the fires that are already burning today, like the opioid epidemic or the maternal mortality crisis or measles, which is in now 19 states and counting. There's no two ways about it. This is the kind of carelessness that gets people killed. Everyone needs to understand this. This is not hyperbole. When our hospitals are overwhelmed with sick kids because our local public health officials can't track a worsening measles outbreak, that is a life and death issue. When E. coli outbreaks become hard to pinpoint or whooping cough becomes impossible to trace, when cancer cures are tossed in the shredder or you can't afford treatment at all because you couldn't get help enrolling in a health plan, all of that is life and death. Maybe it doesn't seem like such a big deal if you're a billionaire like Trump or Elon Musk. Whatever happens, they will be able to afford whatever health care they need. But folks back here in Washington State are the ones who are going to be left picking up the pieces of the health department Trump is smashing to bits. These are not problems that go away on their own. A fire doesn't put itself out, at least not until everything is ashes. Trump and RFK Jr. may be content to let the country burn, but I am not. I am sounding the alarm and doing everything I can to bring attention to this before things go from bad to worse. And I'm so pleased to have some experts with me today who can speak firsthand about the work that HHS does, why it matters to our families, and what is at stake if Trump and RFK Jr. succeed in dismantling this department board by board. So thank you all to my guests today, and let me start by turning it over to Dr. Califf.
Thanks, Senator Murray. And I'm sitting in the middle of an airport here, so I have to be relatively quiet. And also feel like I'm probably not telling any of you anything you don't already know, having already spoken with, I feel like, dozens of members of the press over the last few weeks. And actually, I'm getting a lot of my news from the press because, as many of you know, loyalty is a primary issue with the current administration. So the last thing I want to do is to jeopardize the personal careers of anyone who's currently working at the FDA. But I think you all know that a cut of an additional 3,500 people on top of the arbitrary cuts that have already occurred, in addition to all the people who are leaving because of what they're seeing, is likely to leave the FDA unable to do its critical work. And it's really striking to me how the rhetoric of, for example, better nutrition, enhanced food safety, innovation in medical products runs contrary to what's being done with the workforce. Instead of a carefully thought out plan, I think all of us would probably agree there are things about the federal government that could be better. Many of us would have loved to have seen the HR system improved, but to make the cuts based on words in someone's job description or grants that have particular words in them without a thorough consideration of the issues is likely to jeopardize human lives. And I'll just bring up three quick examples. Number one, of course, is measles, which is on the march in the U.S. in the face of significant anti-vax rhetoric. And it sounds like many of our most talented people are being put to work to try to find evidence to support the conspiracy theories rather than really working on the problem. But again, I don't have firsthand knowledge of that. The second area, of course, is the opioid problem, where everyone, I think, agrees we need to do something about it. But it seems like the programs which are designed to help people deal with it are being dismantled. And then third, and Dr. Bertinoli may want to speak directly about this, I'm hearing about experiments in human beings, that is clinical trials, that are being summarily stopped in midterm without a plan for how to wind the trial down or safely um, take care of the people who have volunteered at their own risk to generate information and knowledge that'll be critical to the public. This violates every ethical agreement that's been made around the world after all the atrocities that occurred in Germany and in the case in Alabama at Tuskegee that everyone knows about. And I feel like this needs to be addressed now because it's happening as we speak. I'll stop there and hopefully I won't be asked to board before the questions come up, but appreciate the chance to speak with you.
I believe I'm up next. Thank you, Dr. Califf. And thank you, Chair Murray, for giving us this really important venue to be able to speak to people. I'm Monica Bertinoli. I'm a surgical oncologist and a cancer researcher. I served as the 17th director of the National Institutes of Health. I am also a cancer survivor who would not be here today if it weren't for research funded by NIH over the past 4 decades. So I want to say I'm also here to represent the many millions of people throughout our nation who have directly benefited and even owe their lives to biomedical research funded by NIH. I resigned my post as NIH director in January this year, and since then, I have no insight into how decisions are being made by our current leaders at HHS. I can speak, however, about the downstream effects of their decisions and some irreparable damage that their current policies are causing. Through the NIH, our country's investment in biomedical research and education has fueled incredible progress. Just consider the 2 biggest causes of death in the United States, cardiovascular disease and cancer. Since I began my own career, the age-adjusted death rate from cancer in the US fell by 34%. And over that same time, the deaths due to heart attacks and strokes fell by approximately 30%. This progress would not have happened without taxpayer support of the NIH. It also fueled our economy. In 2024, NIH generated an estimated $94 billion in total economic contributions and supported more than 400,000 jobs nationwide. Perhaps most important at all, frankly, the thing that's got me the most worried is that NIH funding was an essential requirement for training the next generation of biomedical researchers. We can all embrace the current administration's goals of addressing chronic diseases and achieving disease prevention by promoting healthy lifestyles and reducing exposure to environmental toxins. Those parts are good. However, The current funding cuts and delays, even if temporary, are already producing irreparable harm, especially to those of the next generation, and not just in a few targeted research areas. Ironically, this approach undermines the success of the laudable initiatives championed by the current administration. Standing research labs are laying off staff. As Dr. Califf said, clinical trials are halting midstream. Valuable administrative staff that are essential to ensure that our public dollars are spent wisely and that their use is tracked carefully to avoid fraud or any other kind of risk are being laid off at NIH. And postdoctoral fellows and new faculty members are unable to find jobs. Promising ongoing research is being stopped midstream, and the effect on the biomedical research workforce is chilling. How can we ask talented young people to continue to devote so many years of study required to succeed as a biomedical researcher when the future is so uncertain? Today, we are just beginning to see progress in such devastating diseases which have long been hopeless. Alzheimer's disease, diabetes, pancreatic cancer. There's cracks in the wall for each one of these terrible things, all because of NIH funding. And this has proven to be a great investment for the American taxpayers, producing not only extraordinary progress against the most common deadly diseases and significant profits for our nation's economy. How does it make sense to see progress stalled? The loss to our nation on so many levels is so great. So thank you. And now I'll turn this over to Chiquita Brooks-LaSure, former administrator of the Centers for Medicare and Medicaid Services.
Thank you. Thank you so much for having me today. And thank you again, Senator Murray, for highlighting what an incredibly concerning set of actions that we're seeing from the Trump administration when it concerns HHS. I really want to go back to some things that Dr. Califf said about, we all know, all of us who are former officials know that there are improvements that we would want to make to the hiring practices within the government. But doing so in such an irresponsible way, as we have seen over the last couple of months, is going to be life-threatening to millions of people. The role of CMS is, as you all know, to oversee coverage for almost half of our country through the Medicare program, Medicaid and CHIP, and Affordable Care Act marketplace coverage. But CMS does other things too. It looks at innovative treatments to see whether or not they should be covered by the Medicare program. They make sure that nursing homes in this country are okay and safe, and hospitals in this country are okay and safe. And they move your mom, your aunt, if something happens to a nursing home and it can no longer offer care. And what we have seen over the last few weeks and with this latest action is a lack of understanding of CMS's role and how important it is to be incredibly thoughtful about how you are making changes. So there have been many reports, and as Dr. Califf said, we're learning a lot from all of you about losing people in the regional offices. Many, in fact, I would say thousands of CMS staff work in the regional offices and do core work that is the agency's focus. So when a provider has a problem with a Medicare Advantage plan, they call the regional office. The regional office is the one that does a bulk of looking at what health plans in this country are doing to make sure they're meeting CMS rules. They do a lot of the casework within the states across the country. As CMS administrator, I spent a lot of my time visiting across the country, and most people in the states, their experience of CMS is their regional office. And so eliminating those positions, those are people who, again, are focused on whether the nursing home is okay, whether the facilities are okay. So when we look at reducing CMS staff and then closing some of the other staff in that department and moving those functions over to CMS, it's incredibly concerning. So some of my sister agency heads, their offices, their responsibilities are apparently shifting to CMS. It's not that CMS couldn't be capable, perhaps, of some of these functions over time, but CMS does not, for example, have direct relationship with community-based organizations. CMS primarily works with providers and health plans and states. That's our core relationship in terms of a financial relationship. So closing the administration for ACL, some of these offices, and moving those responsibilities for CMS, they are not already set up. And I just want to say one final thing before I turn it over to my colleague. There's been references to looking to eliminating staff from the Office of Minority Health. It is critical that we as a country be honest about the health disparities that we have in our country, that we look at what some of those root causes are, that we measure some of these basic things. A lot of the role of the Office of Minority Health looks at rural health. So regardless of race, really trying to make sure that people in rural areas are getting access to the care that they need. I think we really have to look very hard at how this current administration is treating health disparities and diversity is something that we should be threatened by, instead of understanding that we have to measure what is important to us, and we have to know what problems we have in our country to be able to solve them. And now I'll turn it over to Dr. Khan.
Thank you. Thank you, Senator Murray. Thank you for your leadership. We really appreciate it. Everything that happens at the federal level eventually filters down to the state level rather quickly. This is where the rubber meets the road, so to speak. We are reeling from the news that we received at 3 a.m. this past Monday about cancellations, immediate terminations rather, of a few grants. Our state colleagues in Olympia, in Washington State, are in the same boat. Essentially, I'll give you one example. 45 community health workers, which are critical to linking people in the most vulnerable and zip codes of greatest need to the services that Administrator Brooks was talking about, and my colleagues were talking about, are now at risk in terms of losing their jobs. We've spent years training them, embedding them with community-based organizations across the region. That is simply not something we can reconstruct if funding should return in a few months' time. What incenses me most as a public health professional is the assumption by decision makers in Washington that somehow, if funding is returned or resurrected 6 months to a year from now, that we will simply pick up the pieces and continue on from where we were. These are not potted plants. These are highly trained public health professionals. They have moved on. They've got busy personal and professional lives. We have just shot ourselves in both feet at the same time. This is a very ill-conceived and ill-considered process, and we are bewildered at what is going on. One example that Senator Murray cited in terms of public health emergencies, measles. We had one case of measles recently in Seattle and King County. It generated 300 contact investigations. Now, if you can imagine the workload, the amount of time required to follow up on 300 people to get them immunized, to get them isolated suitably, to get them linked with medical providers for treatment wherever necessary, that's the amount of work that this generates. At the same time, we have an HHS secretary that keeps talking about stuff that we have to debunk on a daily basis in telling people and convincing people that vitamin A is not the answer, a vaccine is. At this point in time, all we can hope for is some reconsideration of this ill-considered decision, but quite frankly, it is looking pretty bleak. We're having to look at a systematic disassembly of public health services that we've built up over many, many years, if not decades. I will pause there. Thank you, Senator. Back to you.
Well, thank you to all of you for sharing your expertise. And Naomi, I'll turn it back over to you to call on press for any questions they may have.
All right, folks, we have time for questions. If you have a question, please use the raise hand function so that we can call on you. Start with Orion as spokesman.
Thank you, Naomi, and thank you all for doing this call. I wonder if Senator, you or any of the folks on the call have any information about the potential or the planned closures of regional offices, whether that will include Seattle's office, and whether or not that's the case, what closing half of the regional offices would mean.
Well, we don't know. HHS and the president have not given out any information about where that's going to be. If they're going to do that, people need to plan for that. They've given none of that. It's just that they're arbitrarily going to cut I believe it's half the offices. What will that mean? It will mean people in that region will have to go hundreds and hundreds of miles to get access to the same information that they now currently have in the region that they're in. It will mean the regional officers won't know people or communities or contacts from new regions that they have to absorb. That will take a lot of time and energy, and if they're cutting people at the same time, it's going to be impossible. But I can let some of our experts, perhaps Dr. Khan, talk about what that would mean if the Washington State Regional Office was gone.
Thank you, Senator. I second that very strongly. We have counted on HHS regional offices as invaluable partners. We've been on the ground floor as new initiatives have been discussed, as agency links have been established. They've been the bridge between Seattle, King County on one end of the country and Washington, D.C. and the myriad of agencies at the other end of the country. With that office closed, I can only imagine that those links will be severed, and we will have no idea about what is being planned or thought through in Washington. Thank you.
All right, next we'll go to Jesse with roll call.
Hi, thanks for doing this. My question is for Chiquita. So part of the reorganization plan is creating a new assistant secretary for enforcement, and that would include the Department Appeals Board, Office of Medicare Hearings and Appeals, and Office for Civil Rights, all under one secretary. And I was just wondering if you had any thoughts on that.
Well, I would say just taking those three offices, they have different functions. And so again, like in theory, you can consolidate different responsibilities if you do it over time and make sure that people have expertise. Like the Department of Medicare Appeals does completely different work than the Office of Civil Rights, for example. I mean, they're not even in the same universe of like the appeals in Medicare is really based on arguments often between providers and health plans or people and health plans. That is a much more technical clinical issue as opposed to, and also financial, as opposed to the Office of Civil Rights. And so again, I don't know all of the specifics of how they are thinking about the process, but what I think overall is this issue of, do the people who are now going to be tasked with whatever set of responsibility actually have the expertise to do what they are being tasked to do?
Thank you.
And we'll go to...
Can I answer that question from a consumer standpoint? Because that's also really critical here. So if you are a consumer and you have an issue with your Medicare and you believe you should be covered or not, or your provider and you should be covered or not, and there is no one with expertise, or there's half the staff to be able to deal with it and you can't get through, you're going to end up paying more for something that you shouldn't have to.
And now we'll go to Lisa at 8.
Oh, hi. Thanks all for doing this. Something I've been really thinking about, and Dr. Khan mentioned this, I'm wondering if others could also address it, is just the idea of rebuilding or building back. I know in talking with a lot of folks, there are efforts underway by different lawmakers to, salvage certain programs or offices that are being cut both in the health field, but beyond in other agencies as well. But I'm wondering if in the health field, you all could address what it would take to sort of rebuild some of this stuff if some of the cuts are in fact ultimately reversed, or we've seen some of the employees in other agencies, brought back after they've been let go. Can you just maybe expand on that a little bit? Thank you.
So I can take a little bit of that from the science viewpoint. We see grants cut in the middle of the research, and it might be a 4-year grant and there's only one more year to go, and the grant is cut and the work stops. And what happens is you lose all the first 3 years, because the way many of these things are structured, they'll be gathering data and coordinating data and organizing it. And then at the very end is when the final analysis is done. And going back is simply not possible. Certainly that's the case in clinical trials and many of the clinically focused research that we do.
And I will add, from a staff perspective, some of the experts at our agencies, certainly at CMS, but I'm sure it's even probably more true at FDA and some of the other agencies, people who are experts in their field take major pay cuts to come in. You work so hard to bring people into the government. And the last couple of weeks of just intimidating staff, pushing out some of the retirees and urging people to take early retirement. One of my colleagues mentioned some of these systems, they're written in COBOL. They're written in languages that young people aren't even learning at school. And by gutting these programs where we hired a lot of youngish people into the careers to build them up, why would they come back to the federal government? Even some of the people who were let go at CMS have decided, and they've been offered their jobs back, they've decided not to come back because they know that things are really uncertain. And you lose that expertise, you lose the people who really understand how easy it is to break systems. It takes a long time to learn what the role of some of these agencies are. Even people who are experts in one area, you don't know how vast some of these responsibilities are. It's not just, I think Dr. Caleb said, what someone's title, that doesn't tell you all of what their knowledge is, all of what their experience is. And I am really worried that the federal government will not be able to recover from the brain drain if this isn't stopped soon.
I'm going to add something to that as well that I think is really important, because I think one of the goals that I'm beginning to hear from the Trump administration and Elon Musk is that government doesn't need to do any of this. We'll just privatize it all. Well, I will tell you, our public health folks who go out and track measles or track whooping cough or track a new pandemic aren't going to work for a private company. There won't be a private company because their whole goal is to make a profit. There isn't a profit-making course in this. This is making sure that you have the information you need if there is a huge flu epidemic in your region, whether or not your kids are safe, or what you need to do to protect them. If you're in a nursing home, making sure that nursing homes have the right information to make sure their patients are protected from the latest outbreak. There isn't a private company that's going to come in and do that. That is why we have what is called a government agency for the good of the people that has the expertise that can do these kinds of services. It is not going to be replaced by some profit-making corporation. That is what we are losing, the people and the capability to make sure that all of us are safe in this country.
Senator Murray, if I might add, I think a lot of these things being privatized will only radically increase the huge disparities that we already have between people with lots of money and people without lots of money. I've worked in all sectors, and your job in a company is to pay attention to the bottom line and make a profit. And that's best done in this country right now by catering to people who have lots of money. I say that being someone who benefits from that, maybe personally, but it's a good way to not make America healthy again.
And now we'll go to Sarah at Pink Sheet.
Thanks. I had a question about the legality of all of this. Do you have any sense yet of whether the proper procedures were followed for doing these RIFs? And if there are likely to be legal challenges, including whether some of the moves of different parts of the agency or sort of removal slash reconstruction of their different agencies and so forth, is consistent with how Congress asked HHS to spend their money this year as well.
It's not even asked. Congress writes the appropriation bills. We designate how much money goes to each one of these programs and agencies, and the administration has to spend that money. They can't arbitrarily decide not to. So absolutely, this is part of the whole picture that we are looking at, is if this administration is following the law, and we're going to continue to pursue that.
I'll just comment, there's the legality, which is certainly going to be challenged, and we'll see how that plays out in court. There's also the humanity of it, the way these people are being treated, getting emails from an anonymous source being fired with a clearly incorrect assessment of their job performance in writing, with no one to talk to about it, with a very short period of benefits, and then no help. I've, in both academia and private sector, had to do a number of reductions in force, because if you don't have the money to pay people, you have to change it. You can either do that in this kind of an inhumane way, or you can do it in a way that's planned out, gives a runway for people, and enables them to move on to the next thing. And I'm just horrified by the way these people are being treated.
And we'll go to Christina with the New York Times.
Thank you. Yeah, I just wanted to ask, I realize one of FDA's goals in recent years has been to get the number of inspections sort of back to pre-pandemic levels. Um, I don't know if Dr. Caleb can speak to that or any other goals FDA sort of had in mind that might be impacted by this 20% cut.
Well, you guys have done a really good job of writing about this, and I don't really think I can add much. I'll just say that inspections of one of many examples. I'd say the same for product reviews or chemical reviews of chemicals in the food. You might think, well, you just need an inspector, but the amount of work it takes to prepare for an inspection, to make sure they're looking for the right things, so they have the data and information they need, that comes from an intense interaction between the centers. Let's say it's a pharmaceutical plant in India. You've got to have many, many people who are preparing for that, getting everything ready, making sure that diplomacy is taken care of because you're going into a foreign country. So if you say, well, we're just going to take out middle management, that's all the people that make that work. And the point has been made in several of your articles that when this has been tried before, what looks like a simplicity of centralizing actually leads to inability to function because there is no glue holding the parts together. And to a comment Senator Murray made earlier, and I've got to go get on the plane, so this will be my last comment. I don't know, at age 73, as I'm moving back to my home we've always had in North Carolina, I don't know how you feel, but when I try to have a problem and I try to reach a human being and all I get is a set of endless numbers from 1 to 6 on a AI app, it's infuriating. And if you think about all the people that are needing Medicaid and Medicare, for example, or even the companies interacting with the FDA about critical issues in drug development that could be $200 or $300 million decisions, the idea that you're going to take out the human factor is just ludicrous. And I hope everybody, if this happens, gets to experience the fun of spending 2 or 3 hours trying to find a human being on the other end of the phone.
All right, I'm not seeing any other hands raised. We do have a bit more time for questions. If you're not able to figure out the raise hand function, or you would just like to unmute yourself, state your name and outlet and ask a question, I'll give folks a minute to do that.
Maybe while we're waiting for somebody to ask something, I can throw in two really quick things. First of all, I mentioned that we might be losing really chilling effect on our biomedical workforce. We know that this can happen because we've had reductions in NIH funding for brief periods in the past, and we've tracked very carefully what happened to the next generation, and we lost. They left. They went to other fields. They did not enter this kind of work. You have to be altruistic and really want to work incredibly hard for a long time before you get into this workforce. And we lost those people. The other thing I'll say very quickly is we're also getting a fear across the agencies. These are really great people who are just there to serve, and they're afraid to do their job right now under the current setting. And that to me is another just tragic environment, and something that we really need to find a way to fix as soon as possible.
And next we'll go to Aaron at Politico. Aaron, you might need to unmute yourself.
My apologies. I know if you're referencing me, I'm actually at National Journal. I wanted to ask this because I know even before yesterday's announcement, the Office of General Counsel had announced the closure of 6 regional offices themselves. And my understanding is that they are also another enforcement arm. They also help ensure that nursing homes are safe, and provide advice to other agencies within HHS. And so I was just wondering, combined with the staffing cuts that were announced yesterday and the other regional office closures, I'm just wondering kind of where that leaves enforcement and ensuring patient safety and quality within facilities receiving Medicare and Medicaid funding.
You are absolutely right. The Office of General Counsel works closely with CMS on a number of issues, and certainly enforcement is a big part of that. And that work is typically done in the regional offices when we're talking about nursing homes and other facilities. So I'm extremely concerned. As I said, I think most of the staff that CMS in this round who it seems like may be let go are actually involved in oversight and making sure that people get the care that they need. Providers are doing what they're supposed to, health plans. There were people from the Office of General Counsel who did work on CMS programs who lost positions in the round a couple of weeks ago. So, the work that CMS does is integrated with other parts of the department. And I bring that up just to say there is in this language that Medicare and Medicaid are safe. But the thing is, just because the Medicare or Medicaid isn't in your job title doesn't mean you're not working on those programs.
And from a human perspective, what that means, if you're putting your parents into a nursing home and you have no assurance that it's been inspected or will be inspected, or that there's the correct number of personnel there, or medications are taken care of, how can consumers feel like their country is there at their back to make sure that when you do have to make those very tough decisions for your family, that you're making safe ones? Or if you go to the drugstore to buy a drug, has that been inspected? Can you be assured that if you buy something off the shelf, it does have the backing of all of us, that it's been inspected and you are safe? We lose that. Or if we know there's a food-borne outbreak that maybe lettuce from some store is not safe, but there's no longer anybody there to make sure that they are tracking that or getting the information out. This is going to leave everyone in America with unease, and we shouldn't have to live like that. That's what these kinds of cuts overall are doing. So that's why we are fighting back so hard.
All right, one last call for any final questions. And not seeing any, I'll turn it over to Senator Murray to close us out.
Thank you very much to all of you. We will be talking about this a lot more. What we're doing right now is raising the red flag. People out there need to understand the impact on them personally and let their members of Congress know that they will not settle for a country that isn't safe because we're slashing and burning people. Thank you.